to this, the 10th edition, I suppose. What I'd like to do really is just take the opportunity, just to say, to take a few minutes of your time to evidence how we here at Mansfield endeavoured to make the We Are Undefeatable campaign very local to Mansfield, alongside the national We Are Undefeatable campaign, and hopefully do justice really to all the hard work that's taken place with the team that are all sat elsewhere. I got the straw for this, and also really I want to do justice to the reports that we've also put together over the last 24 months, evidencing how we've actually moved forward with this campaign. So why doesn't this? Okay, sorry, that's me. So how did we make it Mansfield? Well, as I've said already, and as I've been introduced, I'm Stephen Cooper, based here, and I work for with the Mansfield CVS. And for those of you not sure what a CVS is, it's basically an infrastructural organisation that predominantly supports the voluntary sector, and is known to be a community and voluntary service. As I say, we deliver an infrastructural support in all sorts of creative ways today, and really partnership working, as you'll hear from me and from one of our films today. Partnership working is well and truly in our DNA. Mansfield was chosen to be one of the 10 activation areas for this particular piece of work with We Are Undefeatable. And what we decided to do in January of 2020 was really working in partnership with Sport England. We decided to put a model together where we would have an oversight group, and that oversight group would actually come from members of the voluntary sector, the NHS, CCGs, the integrated care system, now integrated care board, things are always changing, Mansfield District Council, and Notts County Council. And the idea was to develop a strategy for that year, because initially this was going to be a one-year program. And out of those conversations and initial meetings that the oversight group had, we decided that we would focus on four main areas, and that would be about messaging and communication, workforce development. We would look at how we could actually create new networks, and how we could actually work to support influence change in Mansfield and wider. So we worked really hard, and we've got things all planned, and then this COVID-19 and the pandemic came in place, and I'm sure, like many others, we had to really look at how we could evidence our adversity in the workplace. Interestingly enough, we were kind of knocked off our feet a little bit, because what we wanted to do was obviously deliver a lot of face-to-face workshops with people with long-term health conditions, with organisations that actually supported and delivered services of different type to those individuals. And obviously, because of COVID and the requirement for them to isolate, those plans were very much put on hold. So we had a look at what we really needed to do and how we needed to go forward. We wanted to maintain those four areas. We just knew that really what we needed to do was plan another model really quite quickly, and understand how we could achieve as much as that. And obviously at that time, nobody had a clear understanding of how long this pandemic was going to affect not just the We Are Undefeatable campaign, but the whole world. Interestingly enough, in this work, our oversight group continued to grow. But what we did start to do was, as a CVS, we started to get involved, obviously, with the food banks, because people were isolating and unable to shop. And we were also got heavily involved in supporting and actually delivering many of food parcels around the Mansfield and surrounding areas. We could see that this was a great opportunity to actually put leaflets together, and we created local leaflets that actually evidence the type of physical activities that individuals could actually be doing within their own homes or digitally. And we tied that up alongside, because at that time Sport England had created their national leaflet, and so we will be able to put the two together. And not only was that ourselves, but we'd helped set up befriending lines And so when people were actually having conversations with their befrienders and starting to feel a little bit unsure or starting to wonder about how things could open up, those befrienders could also, again, start to have that conversation about, things like physical activity and maintaining some level of well-being. The workforce itself within the community also mirrored what we were actually doing. And at that time, we also were very, very close with our walk and talk volunteers, who I'll mention a little bit later on. And they played a significant role, again, in delivering leaflets and ensuring that those people who were not digitally equipped had a clear understanding of what was actually happening in their community. And to start with, even though we were quite comfortable with this particular model, we also had to recognise that there was quite a fear factor, that people were being asked to isolate and they were fearful of their own potential increased frailty. We started to hear conversations on the media and everything about long-term COVID becoming another long-term health condition. And so what we really had to do was we recognised that we just had to give people a little bit of time. And so even though we'd started to put plans together, for a short while, as the lockdown really did kick in, we did just ease off very, very gently. And then I remember coming back to the office once and talking to my colleague Leslie, and I said, look, I'm starting to feel out there that the timing is better, that people are becoming bored and they are starting to ask these questions a little bit more when we're dropping off food parcels and doing other work. And that's when we really started to sort of move forwards and really build up upon this campaign to ensure that people were aware. As I say, it was specifically around individuals who were not digitally equipped to be able to receive and take on those offers. Mansfield CVS has always had a strong network of voluntary sector organisations and has always had a strong relationship with health, with its own council, with Nottinghamshire County Council. But I have to say, and it has to be mentioned, and that is that the work that we've done over the last 24 months, the Sport England and the We Are Undefeatable national campaign, without question, has improved, widened and strengthened those partnerships and networks that we already had in place. It's also opened doors to new opportunities, and it's placed Mansfield CVS at significant higher levels when strategic conversations have been needed to take place about, whether it's about health inequalities or about physical activity and how it can actually be supported and how it can actually begin in particular and different areas. The professionals that we've now met with and we meet with now on a more regular basis have done everything that they possibly can to actually support us and work very, very closely with us to actually amplify the We Are Undefeatable campaign. And whilst we would openly state that it would be something that we would have been able to have done to a smaller degree had we not been financed and involved to be able to actually do this, the We Are Undefeatable campaign, the National Sport England campaign, has absolutely amplified this and raised our positioning, not just as a CVS, but as a voluntary sector across the board. What I would just also like to say is that our research has also shown that that campaign still hasn't quite hit home with Mansfield, with our general public, but we genuinely think that as COVID is as much to do with that as anything else, and we still continue, and you'll hear with our legacy work and everything, how we want to continue to actually support and amplify what Sport England want to do at a national level. So I've already mentioned how doors have opened for us. Mansfield Health Partnership, we've seen throughout the time that I've been involved with this, that we've become a regular agenda item, both operationally and at a strategic level. Within Mid Nottingham, with the ICS, we're already being asked if we can actually deliver future presentations around the findings, around the learning, and we've been constantly an agenda item on numerous meetings where there's been this interest about how we've actually used physical activity and involved people with long-term health conditions to become more physical active, and also how to recognise. But not just at those levels has our work amplified, also at grassroots level. in place-based work. We have numerous priority areas in and surrounding the Mansfield area. And here I list just a few. And we're constantly now being asked how we can actually work closely with these teams who are already working very hard in those particular areas, and look at how we can actually embed physical activity as being a default sort of conversation piece in the work that others are actually doing and closely with ourselves. So how did we really manage to sort of start this and kick off from January last year? Well, again, it has to be said, and I think it's very important to recognise that, you know, we are a CVS. I talk about us as if I've been here for many, many years, but nothing could be further from the truth. I actually applied because I saw the We Are Undefeatable campaign. I had an understanding that Mansfield had been picked as one of the areas and there was going to be focus on it. And so I actually applied in 2019 to actually become the project lead for this campaign. And to just give you an idea of what I'm trying to do there really with the foundation and the way that we're able to move forwards, by February 2020, after starting work with the CVS on the January the 4th, we were able to actually launch a very successful We Are Undefeatable campaign in the latter days of February with Mansfield Town Football Club in partnership with other voluntary organisations, and the attendance was close to 100 people. And it just shows just how we can actually move on. And from there, as I say, there was already in place 8/10 of an oversight group. And this is able to happen because CVSs, and this CVS in particular, is seen as a trusted voice, not just by individuals with long-term health conditions, but by people who work in organisations to actually support individuals in our area. I was able to very, very quickly start to have conversations with people because of the Mansfield CVS database. And so people who was at that time becoming on board as social prescribers, link workers, and latterly green social prescribers, but also varied areas and organisations that wouldn't necessarily be actually considered to be deliverers of physical activity around Sport England, such as, you know, museums, theatre. Our library was very interested, and many community centres latterly became more and more involved in what we could do. And of course, you know, the partners that were already in place, the workforce from those partners from the word go have played an active part through COVID, and now on the other side of lesser restrictions, have played an active part in ensuring that this project has reached as many people as we possibly can. I mentioned at the beginning that one of our models really was to meet with people face to face, and it became evident that that was something that we were just not going to be able to do because of the lockdown. So as the lockdown became a significant part of many people's lives, we decided that we would put a survey together, that survey would be accessible, either printed or digitally, and that it was promoted and marketed through our Facebook, our social media, but also through our befriending teams, and again, through our partners and our community workforce that have been a significant part of this from the word go. And what we were trying to do at that time was we just wanted to ask some simple questions. We wanted to really understand what were barriers at that time, pre-COVID and at the time of COVID and lockdown, to physical activity, what worked well. And we got some interesting answers. Obviously, you know, we weren't surprised when some of the things around access to buildings came up and became an issue. But also there was conversation about how offers were actually made, the marketing and promotional literature. Was it always actually the language? Did people understand it? And sometimes did it actually meet the needs of certain individuals? But a major player into reasons why people were not actively involved in any form of physical activity, and lots of people talked about this as around formal activity at the very beginning, was around cost and around transport to actually be able to attend these activities. Well, with transport, what we started to do was build a relationship with our community transport teams. We have two that flourish in the Mansfield area, and we started to build an understanding and make sure that our networks had a greater understanding of how they actually worked and what their costs were, and that we recognised that they were significantly lower than commercial transport and public transport. But also, we also recognised that the issue around cost, that sometimes individuals that were struggling with cost actually were not aware of their full entitlement around benefits. And so what we did is we organised training with organisations that actually delivered benefits advice. But instead of delivering benefits advice to people with long-term health conditions, what they did was they actually, within network meetings, they actually met with organisations that were actually wanting to deliver physical activity and support, to actually give them an understanding as to where to signpost people to. So they didn't become the benefit advisors, they just knew who those benefit advisors were out there, and they would then sort out the eligibility and hopefully ensure that people were in receipt of what was rightfully theirs. And that conversation also put us in touch with the DWP, because another significant barrier that we found, and we continue to talk to the DWP about this, was many people with long-term health conditions are fearful that if they're perceived to be actively involved in physical activity, that it could actually have a detrimental effect upon their benefits. And you can see how much that would be a trouble. So again, we've instigated that conversation, and we're continuing to talk at a local level, and they're actually taking it to a national level to raise these concerns. The survey also evidenced to us that there are large communities out there that actually do not connect to what we're actually trying to tell them, what we're trying to offer them. They just do not see this as a part of their lives. They have significant other issues in their life that stops them from meeting and recognizing this. And that's where we started to understand the need for a trusted voice. And I've mentioned here on this slide around community champions, and again I will touch on that in a very short while, when we start to talk about engagement. And so alongside the surveys, we instigated an update via YouTube, and we started to weekly build an update film. And that would then go out through YouTube, again to our partners and directly to people with long-term health conditions. We use YouTube just incidentally because if you leave it on there for a few minutes and then afterwards, it will bring up the captions and the subtitles. So if anybody is hard of hearing or profoundly deaf, it meant that we could open that market. But everything that we covered on those films, again, we're always covered with our local printed leaflets alongside the national leaflets that we'd received from Sport England. Became aware as well that as a voluntary sector, we weren't surprised that, you know, often being closer to that community than a local authority, people felt, because we're trusted, have that trusted voice sort of position, people felt that they were able to furnish us with additional information as we moved on. And this started to give us a clearer understanding as to why Mansfield particularly has become one of the 10 areas that was recognised and chosen by Sport England. We could see that people with multiple needs, and I don't mean multiple, it can be multiple long-term health conditions, but people with multiple needs, it could be debt, it could be other counselling needs, that until they actually get those issues resolved in their lives, or they can see a pathway to that resolve, we could see now that any offers that we were making about physical activity was not going to be a priority in their lives, despite what types of choices and offers of physical activity we might actually put in place. So this is just a quick slide, really, and it's just my little advert. Around you can see numerous individuals, and this is a series of films that we've made. And I urge you, really, after today, when you've got a little bit of time, either through our website or contacting me directly, I would ask you just to go and listen to one or two of the people who have made these films and listen to how they've actually used physical activity to move forwards, but also how they've been creative, within our community. We have an allotment that's become a health and wellbeing centre, excuse me, and all we did was we gave them a bursary of £300. But if you listen to Amanda at the allotment, you'll hear some wonderful stories about how that they're not just digging up carrots, but they're, you know, the work that they're now actually doing that's helping her out towards social isolation, etc. So our legacy, we don't see this as over, because we wanted very much to have this health and well-being hub. We wanted to be able to signpost people. We've decided in our new website that we're building at the moment that we will continue to have a health and well-being hub, and people will be able to use that to actually understand directly what is and what isn't in place. We'll also we will continue with training. We came in contact with Paula, who based in Ashfield, just around the corner, is a physical activities ambassador, and she's done training under fall prevention to numerous organisations and individuals now around physical activity and the benefits of it. And she's continued after being with us in Mansfield. She's moved now. She's doing work in Bolsover and elsewhere throughout the Midlands, talking to workforces that support people with long-term health conditions to hopefully gain a greater confidence. Our conversations with the community champions work that we do, that's enabled us to actually reopen organisations and bring staff out of furlough, so that we've then been able to put physical activities into those organisations. A gentleman by the name of Stephen Lack, who's part of Public Health England, has also been very interested to see how we've actually morphed the two pieces of work and how physical activity has benefited along the way. So delivery, and as I say, via organisations that through community champions have been able to reopen, we've done an awful lot of work where we've been able to actually ensure that these offers of physical activity are made in an accessible way. They actually support and deliver activity to people who sometimes either just don't engage with that traditional support, or at the moment are not eligible for those opportunities through contracted services. As I say, we've always ensured that the offers are accessible, and we've done training with those organisations for them to get a greater understanding as to how to widen their market by delivering a more accessible marketing campaign. And we've been very innovative with bursaries. We've given organisations a cash flow to be able to start and move forward these physical activities, these sessions, to basically feel confident that if the numbers are low at the beginning, they've got money in the system to be able to meet their costs as they grow and develop. So I'm just going to put a film on for a few minutes, and this is Maddie at Vibrant Warsop, sorry, Worksop's further down the road. And it's just to give you an understanding really as how this partnership works not just for us, but for other voluntary sector organisations as well.
I work for Vibrant Warsop, CIC. We formed in 2014. I had no experience working in community. I was an IT project manager, and but through volunteering in the community, I started to get more involved, and that's, you know, that we as a group of like-minded people formed Vibrant Warsop. I grew up in Warsop, left when I was 21 and came back in my 40s. Vibrant Warsop are interested in people and about bringing people together for the goodness of our own health, and for us to get the best out of ourselves. Our vision, Vibrant's vision, is about awakening our shining diamonds. We know in our community everybody needs to shine. We just want to help people shine, and we know we work best when we're working together. So we work in partnership wherever we possibly can, because that's just it strengthens everything. And I'd say partnership is in our DNA. We want to work in partnership with people. We don't have great ideas, we just support great ideas. And what we found is that working with people in the community, if you're working with someone who's passionate about something, they'll naturally put the energy into that to make it work. And we're just about supporting that energy until it helps something come to fruition. Vibrant has had a lot of support from Mansfield CVS over the years since we started. As I said, I'm not from a community development background, but working with Mansfield CVS introduced us to lots of support areas. So they first introduced us to Active Knots, and we've built that relationship over the years. So they're an amazing organisation, and I think if it wasn't for having a CVS around, we might have been pretty lost in terms of knowing who to talk to about support, etc. Locally, we were working with a lady called Mary who runs a carers group. But Mary's been running this for a number of years and had recently moved to the Oakland Centre to run sessions. So the sessions are for the carer and the cared for. They come together, they have lunch once a month, do yoga, and in that group the carer gets cared for as well as the person who needs the caring. And through Undefeatables we've been able to get some support which helps the Oaklands give Mary support. So it's kind of helped build that capacity so that she's still managing the sessions as a volunteer, but she's got some support to do that, and it feels like this group now has some longevity. The breakfast meetings that Mansfield CVS run, we've been introduced to quite a few people at those sessions, at those networking sessions, and one of those people is Helen Dajinski. So she's a social prescriber, and I met Helen prior to lockdown, not realising how much I was going to need her help through lockdown, and so I wouldn't have made that link without Mansfield CVS. Making that link then means that we can go on to throughout the lockdown period. Helen and I were already connected and were able to help each other. So where the people that Helen works with who need most vulnerable people, we're more aware of their needs, which we wouldn't have been before, and can give support where it's needed. Here where the shed's located, where we're running the session today, we're right next door to the medical centre. So one of the things Leslie at Mansfield CVS recommended I should do is join the PPG, and I didn't know what PPG was. So it's a patient participation group. So I joined that. I met Aaron from Riverbank Surgery, and what we were able to do from a community perspective is advertise, help marketing, help get the messages out when there's a flu clinic, when things are going on, and we're starting to learn a bit more about what the centre needs in terms of, you know, more support. It's really important that district councils and county councils, other statutory provision, has these on the ground links. So for example, as residents we get to know people, and as you get to know people they share their stories, and only in sharing their stories can you then tap into what the true needs are, because a lot of communities they'll carry on. You know, if there is no support there, they will just carry on feeling lost and unsupported. Having people living and working in the area and then linking them to that statutory provision, you know, we feel as though we're acting as a bridge, that we can then talk to Mansfield CVS or talk to the district council to say, we've got this happening in our community, but these guys won't say anything and they don't know who to say it to. So can you find us any support? Is there support there? And lo and behold, okay, it's not always yes we can, it's well, how do we work that out together? If I hadn't been working with Active Knots and come to the Undefeatables presentations, because I'm aware I've working with Active Partners Trust and Mansfield CVS, if they tell me something's interesting, I'm listening because we work so closely together. So therefore, in terms of Undefeatables, if it hadn't been for that working in that partnership, I'd have probably seen the national campaign and it not gone any further. In terms of the work that we did through COVID and phoning people and keeping in touch with people, we were able then to say to them coming out of lockdown, you know, but that was specifically funded. You know, we wouldn't have had the capacity if we hadn't had some COVID funding to keep that, you know, to keep those phone calls going and checking in with people. For me, the best advertisement is word of mouth, and the more people we touch, the more activities we've got going on where somebody can say, oh, I've been speaking to my neighbour, they were feeling a bit low, you know, and I've told them to come along to this, but they don't really fancy this, can you do that? I think you have to have a combination of everything. We use the parish news to talk about things, we Facebook, we email people on I think there's about 300 people on the mailing list locally. We want more because there's, you know, we've got 10,000, 12,000 residents, so we need, you know, we can reach more people. It's capacity, really. But it is a combination of everything. You can't really rest on your laurels. Having the links with Helen at the social prescribing link, it's people talking to each other, but you have to work at it. It doesn't just happen. For us to carry on doing the work that we're doing, we need increased capacity. We need people on the ground like our Vickies and our Phoebes who meet people in the community, who listen to their needs, and, you know, just have a cup of coffee with them to then kind of continue to develop projects. So we need funding, is the bottom line, to do that. The other side of things for me that we need is we need statutory organisations, councils, to be given the flexibility to work differently. They have a model and they continue through that model, and whilst it feels difficult sometimes, we have to challenge that model. So if we're looking at introducing, I've already said, I think that we are a bridge organisation, so we're getting the bums on seats that need to improve their health, and it's not because they don't want to do it, it's just they need a means, they need to be able to feel safe to do it, and then we can help link them to the activities or support that they need. Councils need to kind of just take a step back and challenge their own framework sometimes, in terms of, can we think about doing things differently in partnership with these community organisations, and how much more can we get out of it? Just having that conversation is really important.
Okay, well, thank you, Maddie. That's really the end of my sure I have. Somebody just told me they can hear me.
Yes, we can hear you.
Yeah. I had a lot of commotion outside, so I clicked my microphone again. Sorry. So that's my presentation. I just like to say thank you to everybody. I think I've overrun by a couple of minutes. We've got numerous reports that are available. I don't think I've really today's done those justice. And we've got numerous videos and testimonies that people can draw from our website, or contact me directly, or Leslie, my colleague in all of this. So yeah, it's over to yourselves if there's any questions. That's my last slide, Barbara.
Thank you so much, Stephen. That's been really, really helpful, and yeah, I think it's quite a unique approach in terms of the CBS leading and demonstrating how you've created so many connections and sparks within the community where there might not have been that, you know, if it wasn't for your existing networks. I think it's been really interesting to hear about that. I did have a couple of questions that I thought we could filter through to you. One was around, you talked earlier on about how We Are Undefeatable has strengthened network relationships. And obviously you've had the investment, but I think you were talking more broadly about the campaign in general. And I was just wondering if you could elucidate a bit in terms of what was it about the campaign that helped you to strengthen those relationships?
I think the fact that it's a national campaign, we were part of a national campaign, and as it comes from Sport England, gave a significant level of credibility, and so people were able to see that campaign both in the press, on the television, and in social media. But I also think the creativity around the campaign, particularly hit the right buttons for the decision makers, let's just say, in the area. And so you know, we were able to, because of that, the sort of messaging that we were actually giving, it was a very simple message. It was also about recognizing and understanding what physical activity is all about. But the reality was that the campaign itself just it gave that clarity, but it just raised our positioning throughout the now 24 months. You know, it was initially going to be 12.
Great, thank you.
And as I said before, it just opened doors that in the past I think had been not always as open and as you know, and those opportunities. I think I said to you before, we realised we'd gained the ear of individuals out there that perhaps the CVS had been trying to do in past activities.
Yeah. Brilliant. That's great to hear. And just to pick up on a little bit of some of the chat that's been happening whilst you've been talking, there was a query around whether your activity has been delivered through contracted services and the extent to which you've also worked with local sports clubs. And I just wondered if you could expand a bit on what you've done in that area.
Yeah, and it's very much been both the voluntary sector and also being well aware. So organisations like ABL, who are a contracted organisation, we've ensured that they're also recognised in all our promotion and marketing. They've attended our oversight groups. I'm thinking of IAPT as well, another contracted agency. And then alongside that, there's been numerous different leisure centres, managers, staff of those leisure centres, because the oversight group and its attendance has varied as kind of the call to action has varied over the 20 months. There's been different times when they've had, you know, they've been more involved than at other times. So no, this campaign has been absolutely across the board. Anybody who is offering any type of physical activity, whether it's formal or informal, that we've become aware of. The Forestry Commission down at Sherwood Forest, you know, they've also played a significant part in all of this. It's been anybody and everybody that we are aware of that we can support them to actually get their offer out there in the most appropriate way.
Fantastic. And then my last question, unless anything comes through in the chat in the last few moments, is just around something you mentioned earlier on about the DWP agenda, that the barrier you identified around people worrying about their benefits being affected. I wondered if you could just talk a little bit more about that and perhaps the stage you're at with that agenda. Okay,
well, it came on quite early on. And it was something that through my past work, I was also a little bit aware of. I've done work with the DWP on occasion. What we recognised was that, you know, within the DWP mechanism, and you've got work coaches that can be incredibly supportive of trying to get people to get into work or get back into work. But also there is an assessment centre that is usually disconnected from that work coach conversation. Many people with a long-term health condition will have experienced that, and so we know that was that the fear was that if they were seen to be doing something that was physically active that kind of went against, you know, the issues that people perceive that you may not be able to do because you have a long-term health condition, it could put you in danger. So at a local level, because COVID has played a very stalling part with all of this, but at a local level, we started to have conversations with the DWP staff at the Mansfield Job Centre, and they started to look at how they could actually address that and started to have internal conversations with their assessment teams. And interestingly enough, just very quickly, but one of the things that came out of it was I was asked then to go and return, because we realised that actually people with long-term health conditions who've got a physical activity or was a hobby, it could actually be a way to actually disclose your long-term health condition in a positive way to get an employer to look at you differently, to actually then offer you a job. So we came up with all of that with just this local job centre. What's then happened is that within that, the DWP themselves, the staff who are basically, they've taken that on further. But as I say, I think we would have had a more positive outcome had it not been for COVID and DWP's own issues at the moment. But we're continuing to have that relationship with them and ensure that we can do everything we possibly can to keep that conversation going so we can take that fear away at a national level.
It is, yeah, isn't it? And I know that Alison in the chat from Bolsover has mentioned that she'd like to connect with you about that. It feels like that's something we should stay connected on more generally, because there's probably work to do at a national level there. But that's really helpful to hear where you've got to.
Well, personally, I'm an advocate, for disabled people and people with long-term health conditions being in work. Work gives you a wage, and if that then resolves the cost issues for actually, and the other thing is quite often work into bad physical activity, is it? And so we need to look at and address this issue because, I noticed through the 24 months, that employment and people with long-term health conditions doesn't get raised very often, and we need to look at how we actually raise that and move it forward successfully.
Well, thank you so much for your thoughts on that and for your presentation, and indeed all the work that you and the team have done in Mansfield. It's been great to hear about today. We'll bring it to a close there. I just want to say thanks as well to the attendees who've joined today. If you want to catch up on this or all of the other sessions, we'll be sharing the recordings following the event. But we'll close there for now. And if you have any other questions for Stephen, there's his email address right here on the slide, or you can contact me, barbara@insightangels.com. But we'll close there. Thank you all.
Thanks, Barbara.
Bye.
Thanks to everybody. Bye-bye.
Bye.